I will be talking about the cardiac responses as well as the vascular responses in acute aerobic exercise in this video. So we want to make sure that we do know what does the cardiovascular system does for us, which is just to carry out the oxygen and nutrients throughout the body and to the muscles, right? So what happens when we exercise? When we exercise, there's a lot of things that increase, such as the heart rate, the stroke volume, the cardiac output, which is the amount of blood that your heart pumps, as well as your oxygen uptake goes up since your body is in need for demand for more oxygen. The systolic blood pressure goes up and all that. I'm sorry, and the increment in the venous return. So this and the skeletal muscle pump contraction, it just basically causes the muscle to contract and increase the dilation of the arterioles. They also, with it in your lungs, your interpleural pressure increases and drops. And then the respiratory by the respiratory muscle pump. Um, Focusing on the metabolic side of it, in aerobic exercise, we use oxygen to break down the glucose, right? In order to produce ATP. So in that area, your muscles demand of oxygen. It's greater. So that takes us to the vascular responses. The vascular response in the aerobic exercise is due to the increase of blood flow that is going on in the muscles that are being activated. Um, it causes the vasodilation, which is of the arteries, which is the widening of the blood vessel. So the blood vessel, so it it basically just whites to allow the blood flow to come in so it can circulate throughout the muscle while you're exercising. On the other hand, we also have the vasoconstriction, which is the narrowing of the blood vessel due to the muscle contraction on the muscles that are being used. So, in order to get the blood flow going to the muscles that are being activated, then there's the vasocontraction, which it narrows down the blood vessels of the muscles that are not being as active or used. Basically, the blood flow in other parts of the body are restricted in order to help out the part being activated, right? So basically, all of this aerobic exercise activity, it improves the vasodilatory capacity, and since it allows more blood flow throughout your body when you're moving, it reduces the arterial stiffness, and that is important because it improves your cardiorespiratory fitness, and it does lower the risks of you having cardiovascular disease or any type of diseases as in obesity, diabetes,